I'm Dr. Emily Chan, naturopathic doctor, and I'm here to help you get your health and life back. I'm on a detective mission to help you figure out what really is causing your illness and to get to the bottom of it. To help you get rid of the pain of being held back because of your health. To give you the chance to have that miracle recovery. To inspire you to be empowered. I am here to help you love your life. Hi, I'm Dr. Emily Chan, naturopathic doctor and founder of Modern Integrated Medicine, and I specialize in mood and behavioral disorders. I've helped hundreds of patients with anxiety, depression, OCD, and ADHD improve without medication. I use cutting-edge neurotransmitter testing that few doctors use, which gives insight to which brain chemicals are out of balance, so that the most precise treatments can be made. According to the CDC, over 11% of children in the U.S. are diagnosed with ADHD. You may be watching this video because you have a child who is not doing well in school and you're not sure what is wrong, but know that you want to try something natural instead of medication. Naturopathic medicine offers your child an opportunity to gain power over his ADHD so that he can succeed in school, make friends, and most importantly, grow up to be the best version he or she can be. I had a 7-year-old patient who came to me for ADHD. He was not focusing well in school and had frequent emotional outbreaks. He would flap his arms when anxious and was very picky about the texture of foods and clothing. When the teacher would tell him to pay attention or stay in his seat, he would get so sensitive and upset that he would hide under the desk. The conventional protocol for kids with ADHD would be to medicate them with frontal lobe stimulants such as Ritalin or Adderall. However, one of the side effects of these medications is anxiety, among others. Many kids tell me they don't like the way these medications make them feel because they aren't themselves on it and experience more unease and anxiety. The good news is that natural therapies often work well with conditions such as ADHD. Specific tests can be ordered to test a patient's neurotransmitters, such as cortisol, adrenaline, serotonin, dopamine, and GABA, to find out exactly what the situation is so that the treatment is specific. This takes the guesswork out. I've seen way too many patients given drug after drug after drug, like a trial and error situation. This is painful for the patient to go through side effects, as well as the time consumed in unsuccessful therapies. It turns out after the specialized neurotransmitter testing that my 7-year-old patient had a very high level of stress hormones such as cortisol, epinephrine, and norepinephrine. This tells me that he is chemically anxious and in fight and flight response, which the Ritalin can make worse. When a person is in fight and flight, the brain diverts its blood flow to the primitive emotional centers of the brain, such as the hypothalamus and amygdala, and away from the frontal lobe. The frontal lobe is the part of the brain needed for logic and to concentrate. So if your kid is stressed out, blood flow does not favor the frontal lobe, which makes it harder to concentrate. On the flip side, let's say that if your child was low in dopamine, and dopamine is associated with motivation, then a stimulant medication may not be as detrimental compared to the other child who is nervous, whose nervous system is already in hyperdrive. Now you can see why it is important to test your neurotransmitter levels so that treatment can be specific and you can get better results and less adverse reactions. The neurotransmitter testing is easy, requiring only a urine and saliva sample so your kid doesn't have to worry about needles. My patient Rico improved on his follow-up appointment when we implemented specific strategies based on his neurotransmitter test profile. We had a wonderful conversation at the office. His arm flapping decreased significantly, and his mother reported that he stopped hiding under the table at school. Here are 3 facts about your brain chemicals. Number 1, did you know that you need vitamin B6 for your body to make GABA? GABA is a brain chemical that helps you feel more calm. Foods rich in B6 are sunflower seeds, meats, fish, prunes, spinach, yams, and lentils. Number 2, did you know that cortisol levels are supposed to be different throughout the day? Cortisol should be high in the morning so you have the energy to wake up and lower towards bedtime so you can calm down and sleep. Some people have a reverse cortisol curve and find it difficult to wake up in the morning and hard to sleep at night. By sleeping earlier, say about 10 to 12 p.m., you allow the body's circadian rhythm to be in your favor. Also reduce the blue-colored lights, such as those emitted by computers, TVs, or alarm clocks, especially 1 hour before bed. And number 3, did you know that your intestinal tract contains more serotonin than the brain? Research shows that GI health affects neurological health. Probiotics have been shown by research to have a positive effect on anxiety, depression, and ADHD. I'll list a couple of my favorite probiotics below. Remember, there is hope for your child to be able to do well in school. There is hope that your child can be in less distress and have the self-confidence to feel good about himself and treat others well. There is hope that your family can have more harmony when your child's behaviors do not get in the way. Thank you for watching Dr. Emily Chan Media. I'd appreciate if you like, comment, and share this video so that more people have the chance to learn this life-changing information.